If we talk about inflammation, so inflammation basically refers to any sort of issue, any sort of um, cells which is moving from the vessels, and from the vessels it has moved into the tissue. So suppose I draw these vessels here. Okay, there are vessels here, and the vessels have all those cells, like it has monocyte, it has lymphocyte, it has neutrophil as well. So basically these cells must move out of the vessels to the area where there is inflammation. So these are all the antigens, and it can also be the it can be infections, it can be just an antigen which is not an infection at all. So all these cells which is moving towards the area of inflammation or the infection or the antigen, and they will remove them. Okay, so cells moving into the vessels, and from the vessels it is moving into this antigen, removing it. This whole event is called as inflammation. Okay, this whole event is called as inflammation. Okay, अब देखो, when we talk about such type of inflammation, it must be very very clearly understood that inflammation actually it refers to a event in which the cells are moving from their own routine sites. That means we can define inflammation like a response. Okay, it's a response of vascularized tissue. Okay, it's a response of vascularized tissue to infections and damaged tissues. Okay, it must be very clearly understood that it is response of this vascularized tissue, okay, to the infection and the damaged tissues. That is very very important. Now, sir, does the vessel respond to it? Does the vessel respond to it? Actually, yes, vessel respond to it. But in the vessel, what responds to it? That's an important question. So what response are the host defense cells? Okay, so we will write that brings the host defense cells, host defense cells from circulation, host defense cells from circulation to sites where they are required, to sites where they are required. ठीक है, but question is why are they required there? To remove the offending agents. Okay, to remove the offending agents. So this is how we define this inflammation. So again, read this line: role of vascularized tissue to infections and tissues that brings the host defense. Now this line is very important: host defense cells from vessels to sites where they are removing the offending agents. Where they're removing the offending agents, this whole thing is called as inflammation. Clear? You know, two types of inflammation. One is, I'll talk about types of inflammation. Types of inflammation. As you all know, it can be acute inflammation or can be a chronic inflammation. Acute and a chronic inflammation. The onset of acute inflammation is within minutes. That's very important. And it remains till some hours, maybe a few days also. But chronic inflammation, it starts within days. It remains for few months or can also remains up to some years later on. Can also remain up to some years later on. That's again very important. The main mediator of acute inflammation is neutrophils. Okay. Whereas the chronic inflammation main mediator is macrophage, number one, lymphocytes, number two, and plasma cells. ठीक है, macrophage, lymphocytes and plasma cells are the main mediator of the chronic inflammation. It must be very clearly understood that whenever a question is asked on the acute inflammation, okay, acute inflammation, always answer neutrophils, and for a chronic, always answer macrophage without thinking any further ahead. Acute के लिए neutrophils बोलना है, chronic के लिए बोलना है macrophage. That should be very very clear in your mind. Why? How? We'll talk a lot about this in this chapter. यही तो पढ़ना है और पढ़ना क्या है इस chapter में. अच्छा. The outcome of acute inflammation that is self-limiting condition. Now this is very important. The moment we start with inflammation like this, the inflammation must also stop like this. The inflammation, it starts, it must also end like this. It has started, the inflammation must also end like this. Whereas a chronic inflammation starts, it keeps on progressing like this. That means self-limiting is acute. It can be severe inflammation, it can be damaging tissues, it damages tissues, and along with that, it can lead to fibrosis. What the point? So basically, acute starts and stops. Chronic starts, does not stop. It keeps on moving ahead. It will keep on also damaging tissues, and at the same time will also lead to fibrosis. Okay? So first of all, you all should tell me, is this definition clear or not? Because this will make you understand everything about the acute and chronic. In fact, in this chapter, we'll discussing this and further only move to this one. Now, because this is clear, I'll move to some of the exceptions here. Now, take a red pen and write some of the exceptions here. देख होता क्या है ना, that acute inflammation mainly starts with neutrophils, but yes, there are few exceptions. Like in the exception category, acute inflammation has an exception like acute typhoid fever में there is lymphocytosis, okay, and chronic pseudomonas infection में there is neutrophilia. In acute typhoid fever, there is lymphocytosis, and in chronic pseudomonas infection, there is neutrophilia. So that means there is an exception. Even in a chronic pseudomonas infection, still there is no macrophage. There is still a neutrophilia. Okay, why? It's just an observation. It doesn't have a lot of answers there. Now, moving to the acute inflammation. Okay, so for the initial topic, we'll talk about acute inflammation and we'll then move to the chronic inflammation. Let's start with acute inflammation first. Whenever there's inflammation, there are some signs to tell you that the area is inflamed. And what are those signs? The signs were given by Celsus, and Celsus gave us 4 signs of inflammation. They told us there is rubor, okay, there's rubor, there is calor, dolor, and there is tumor. Okay, rubor means redness, calor means increased temperature, dolor means pain, and tumor means swelling. Then the 5th sign was given by Rudolf Virchow. He said that whichever site has an inflammation, that site has a loss of function. क्या होता है? There's a loss of function. That loss of function is called as functio lucia. It refers to loss of function. Function loss is called as functio lucia. Achha. Now, we must understand one thing. Basically, you've got an idea that what is inflammation. Inflammation means, suppose I say that my thumb has an inflammation. It means from the vessels, the cells have moved into this tissue to remove the offending agent. This is what it means. So if I now ask you, okay, now tell me, what are the causes of inflammation? ठीक है, What are the cause of inflammation? And I'm giving you some of the options. You have to choose and tell me what do you think is the best answer. ठीक है? पहला cause of inflammation में infections like bacterial, viral, okay, fungal, parasitic and all. Second, tissue tissue necrosis. Tissue necrosis. Third, foreign body. Okay, foreign body. And fourth, immunological reactions. You need to tell me among these one, two, three, and 4, what do you think can be cause of inflammation? It can be a single answer, it can be multiple answers. Think and tell me. I'm waiting for an answer. You have to answer this as 1, 2, 1, 2, 1, 2, 3, 3 only, 2 only, 4 only, whatever it is. You have to tell me the answer. So the right answer is all of them. The right answer is all of them 1, 2, 3, and 4. Now remember, inflammation can be caused in infections. Surely necrosis, we read this last time. Foreign body can also cause inflammation. And yes, every immunological reaction also causes inflammation. So this also will lead to inflammation. Remember this. Okay. This is a very common mistake many students do. They feel that only 1, 2, 3 can cause inflammation, not this. Believe me, all immune reaction is what? It's inflammation only. Yes. Are you getting my point? Now, let's understand. So now tell us, how does the inflammation occur? So now tell us, how does inflammation occur? So now we'll talk about the components of inflammation. Okay? Components of inflammation. Acute inflammation, it basically has two components, A and B, vascular events and cellular events. Vascular event and cellular events. We'll start with A, vascular events of inflammation. ठीक है? अच्छा, देखो. Actually, in the vascular event, there are two sub events. First one is there is vasodilation. There is vasodilation. Okay, vasodilation causing increase in blood flow. ठीक है? And second is the increased vascular permeability. Okay. Now, obviously, this will cause what? It will lead to plasma leakage. Will lead to plasma leakage. Okay. अच्छा. अब देखो, what is the basic idea of these two events occurring? पहला, if this is a vessel and normally the endothelium is like this, ऐसे, है ना? There's no space between the endothelium. Now, what has happened? The vessels have got dilated like this, ऐसे. Okay. And endothelial cells, they have contracted, ऐसे. ठीक है? The fluid has leaked out. The fluid has leaked out. Okay. अब देखो, if you look at this whole event occurring here, so what you will understand is that because of the vasodilation, the cells, let me draw these cells here, these 4 cells, the number of cells have increased here, right? Because more blood has moved into this area. Now, because the fluid is oozing out, the fluid is oozing out in the vessel like this, ऐसे. The fluid is oozing out, the cells are increased in the vessel like this. Ultimately, think once, more number of cells have moved to the area, and now the fluid has come out. More cells have moved into area, and the fluid has come out. What will happen? Socho. Yes, it will lead to hemoconcentration, and this hemoconcentration will lead to increased viscosity, and increased viscosity will lead to stasis of the flow. Will lead to stasis of the flow. So basically, what is the change in or as increased permeability? They are they are stasis. The velocity of the blood will decrease. That's a main change occurring due to the vascular event of inflammation. Okay. Now, sir, what brings upon these two events? Both of these two events is brought about by histamine, and you all know histamine is coming from mast cells or also the basophil. So both of these event, matlab increased vasopility and vasodilation, is both of them, they come from histamine, and histamine comes from mast cells or basophils. ठीक है? अच्छा. Now let's see that let's now see what are the other mechanisms of increased vascular permeability. This is also very important. Increased vascular permeability. Increased vascular permeability. What are the basic mechanisms? So the three things you should know. One is the mechanism. Okay. One are the mediators. Okay. And one are the time response. Time response. Mechanisms, mediator and time response. Okay. अब देखो. Basically, we're discussing what? Increase vascular permeability mechanisms. The first one is endothelial contraction. Endothelial contraction. It is mediated by histamine. Okay, it is mediated by histamine. The time response you should know is it occurs immediately. Okay, it occurs immediately. So it's called as immediate, but it is only for transient time. So called as immediate transient response. It is called as immediate transient response. Okay. So it means, how does it happen? Suppose there is a vessel like this, and the endothelial cells are like this. The endothelial cells will contract. Okay. Something like this. They'll contract like this. And so a clear space is created between the cells. It is called as endothelial contraction. Remember, it is the most common mechanism which occurs in the inflammation. It's the most common mechanism which occurs in the inflammation. ठीक है? अच्छा. Second is mild endothelial injury. Okay, mild endothelial injury. Mild endothelial injuries. So it will refer, let's write like this. Let's write in a different way. Just write first of all endothelial injury. Okay, an injury can be of three types. Injury of the endothelium, it can be of three types. Injury of the endothelium, it can be of three types. Let's see how. The first thing to understand is the first one that happens is it occurs because of the mild injury. Secondly, it can occur because of severe injury. So what are the mild injury? The mild injury is because of the ultraviolet rays, UV rays. Mild injury, it occurs because of the UV rays. Okay, it occurs because of burns. Okay, this UV rays is actually what, and what type of burn? There is mild burns. So let's write first of all, UV rays means here it can be mild sunburn. Okay, it can be mild sunburn. This means, देखो, whenever the injury has happened, obviously it will lead to increased permeability. But the difference is such permeability will be long lasting. Why? Because you see, it has injured the vessels. Once the injury has happened, it will take some time for the vessel to come its normal state. Because it will take some time for the vessel to come to its normal state, such injuries always for some time. It is never transient. So injury is never transient. Remember this. So the time response for such event, the time response for such event, especially the injuries and mild injury, will be delayed, prolonged response. Why delayed? Because it is mild injury. And why prolonged? Because ultimately it's an injury. And I told you, injury will never be transient. Injury will never be transient. Acha. Next, you should know the second type of injury that can happen is a direct injuries. Okay. The direct injury can be a severe injury. It can be a severe injury. Acha, severe injuries matlab severe burns or toxins. Severe burns or severe toxins like sepsis, like a sepsis. The moment the burn has happened, immediately, immediately the increased permittivity will happen. But will it ever be transient? No. So we call this immediate sustained. We call this immediate sustained response. Immediate sustained response. The third type of injury is due to leukocyte. And we must remember leukocyte ka L for it. Late and long lived. It's late and it's long lived. Leukocyte ka it's late and it's long lived. Okay. So basically, when we talk about the increased permeability, okay, first is contraction. Second is injury. The injury is of three types: mild, direct, leukocyte. How to remember leukocyte? L for late, L for long lived, L for leukocyte. So simple. Acha. Now, some other mechanisms which we can know is like endothelial retraction. Now, this is not a very much, accepted mechanism. Some books will say it happens, and many books will say it will not happen. So, endothelial retraction matlab the endothelial cells, they will separate from each other like this. Essay. It's a normal endothelium. So now what will happen? The endothelial cells without contraction, one of the cell will just get removed from between and a space will be created. But many books say once this endothelium has gone here and this has gone here, so from where have they gone? So many books will say it will not be a valid mechanism. Retraction occurs because of interleukin 1 and TNF alpha. But many books say that this is not a valid mechanism. Okay, it's a delayed and prolonged response. The fourth one is vascular endothelial growth factor mediated, and the fifth one is neoangiogenesis. Okay, so VEGF stands for vascular endothelial growth factor. And remember, whenever the new vessels are formed, the new vessels, okay, new vessels are leaky by nature. New vessels, they are leaky by nature. Okay, new vessels, they are leaky by nature. So that again is very important. So now we have understood there are five, okay, there are five causes of increased vascular permeability: endothelial contraction, retraction, okay, contraction, retraction, injury, VEGF, and neoangiogenesis. Okay, they all are the causes of increased vascular permeability. Now, if you ask me, sir, what happens because of increased permeability? The answer is quite true and correct. What is it? It's a edema. So, fluid and cells will often come out as exudation only because of increased vascular permeability. Okay? Achha, this was what we now talked about, what is called as a vascular event. Let's now talk about what is called as a cellular event. Okay? Is it okay? Let's move to B. Cellular events of inflammation. Let's move to the cellular events of inflammation. To understand this, let's try to make a very good diagram. Okay. This is a vessel. ये vessel है. Okay. And now this is endothelium ऐसे. Some area may show increased permeability, so let's assume there is increased permeability here ऐसे, like this. ठीक है. अच्छा. Now we will draw a neutrophil, and I hope you all know that in a vessel the plasma moves in side axis and cells move in center axis. Plasma move in the side axis and cells move in the center axis. ठीक है. तो center cells they'll first move to the margins ऐसे. ठीक है. This cell when moving to the margin, this first movement is called as margination. It is called as margination. समझ? The first movement of the cells towards the margin is called as margination. Okay? देखो. Now margination occurs because of two reasons. Number one, stasis, and number two, selectance. Number one, stasis, and number two, selectance. Stasis and selectance. Okay. So what happens is देखो, the moment there is stasis, and why is stasis occurring? देख रहे हो stasis के कारण. Why? Increased permeability. So because of stasis, the velocity will decrease, and decreased velocity may all the cell will come to the side. It is called as margination. Now, once the cell starts moving to the side here, these cells are attracted towards selectins, which is already on the endothelium. But endothelium has selectins, which majorly take a role part in the next step called as rolling. So let's see what is rolling now. The step number 2, rolling. Step 2 is rolling. Okay. Step 2 is rolling. Okay. Rolling में there are endothelium and there are white blood cells. Endothelium and white blood cells. On the endothelium, there are E and P selectins. E and P selectins. Whereas on white blood cells, there are sialyl levis X glycoprotein. Sialyl levis X glycoprotein. Sialyl levis X glycoprotein. Remember, this endothelium is having E selectin, whereas P selectin is on endothelium and platelets. Whereas P selectin is on endothelium and platelets. Okay? There's also something called as L selectin, but because not very frequently used, we'll not talk about that. The third step is addition. Again, addition will require some molecules on the endothelium side and some on the WBC side. I'll just extend the table here. So for the addition step, the endotheliums, they have molecule like ICAM, ICAM, and VCAM. The VCAM interacts with molecule called as VLA4. ICAM interacts with LFA1 and the MAC1. Remember, ये V है, तो ये भी V है. V for V. Because this V is a single molecule, we call this beta 1 integrin. We call this beta 1 integrin. Whereas the two molecules here and hence called beta 2 integrins. They're called as beta 2 integrins. Beta 1 integrin and beta 2 integrins. LFA1 and MAC1. Okay. This step is called as addition. So what happens in addition? Let's draw this in a diagram above. Let's draw this in a diagram above. We first write this, I'll then come back to the diagram here. Now in the third step, this neutrophil will be flattening a bit, as it will get flattened out. Okay? And after flattening, they'll now adhere like this. Okay, they very strongly adhere to the endothelium like this, as it. This third step is called as addition. The third step is called as addition. This is called as addition. This is a weak interaction. Second one is weak interaction, rolling, and look at the addition step. Okay, so what is on the endothelium side? ICAM, VCAM, and what are these? Integrins, beta 1 and beta 2 integrins. Achha, in the fourth step, what happens? These neutrophils, they squeeze out of the vessel like this, as they squeeze out of the vessel like this. Now, the interaction between the molecule, both of them are same only. They both are same. And what is that? It's a PCAM molecule. This molecule is called as PECAM, PCAM1, also called as CD31. And both of them are PCAM. Both of them are PCAM1. Both of them are PCAM1. This fourth step is called as diapedesis. Okay, let's move to the fourth step. It is called as diapedesis. PCAM1 and PCAM1, also called as CD31, also called as CD31. PCAM1 and PCAM1, also called as CD31. It is called as diapedesis. अब देखो PCAM1 क्या होता है? PCAM मतलब platelet endothelial cell adhesion molecule. PECAM, PCAM, okay? PECAM, PCAM is platelet endothelial cell adhesion molecule is called as PCAM. Okay? The fifth step is called as chemotaxis. The fifth step is called as chemotaxis. That means if you come back to this area, suppose the inflammation is here. This is the bacteria or this is the necrosis, whatever it is. So this area of necrosis or bacteria or immune reaction, whatever it is, now the neutrophil move towards the area of such area. This movement is called as chemotaxis. This movement is called as chemotaxis. This movement is called as chemotaxis. So we now move to the next step, and the step is called as chemotaxis. Okay, chemotaxis. Defined as it's a unidirectional movement of white blood cells towards a fixed stimuli. Towards a fixed stimuli, it is called as chemotaxis. Okay, it's a unidirectional movement of white blood cells towards a fixed stimuli. It is called as chemotaxis. Okay, acha. Now let's understand what are those molecules which can act as a chemokine. What are those molecules which can act as a chemokine? Okay, so chemokine refers to chemokines. They refer to A, B, and C. Now, how to remember it? Very confusing also. Suppose I ask you to come here. I'll tell you C5A. अब A से क्या? आओ. समझ रहे हो? I'll ask with my five fingers. I'll ask you to come here. इधर आओ. So when you come here, I'll ask you to stand before me. समझ रहा है? So the next step is C5A and LTB4. Before say LTB4. This B4 stands for LTB4. Okay, LTB4. And it is complement C5A. And remember, this is also what is called as cytokines. That is interleukin 8. Interleukin cytokines, that is interleukin 8. Apart from this, even a bacteria, the bacteria can also act as a chemokine because bacteria also attracts the cells towards them. Bacteria also attracts the cells towards them. So, if you look at all of them, it is C5A, A say आओ, stand before me, okay, stand before me, and it is interleukin 8. And it is interleukin 8. Okay. C is what? It's a complement. LT is what? Leukotriene. C is complement and LT is leukotriene. And then there is interleukin 8. And then there is interleukin 8. Acha. Now, if you're wondering, so how do the cells move there? The cells move by the actin polymerization. So all these molecules, chemokines, they act on the G-coupled receptors on white blood cells, and because of which the WBC is contract, release, and they keep on moving ahead. That means, suppose there's a white blood cell here, there's a neutrophil here. On neutrophil, there is a G-coupled receptor. Okay, and on these, the chemokines will act on this acid, because of which these will make a pseudopod like this, okay, and will try to move ahead. They'll keep on moving ahead, contraction, relaxation. Why? Because of actin protein polymerization. Will polymerize, relax. Again polymerize, relax, and keep on moving ahead in the tissues. This is how the chemokines or chemotaxis, they try to move ahead. They try to move ahead. Let's move to the next step now. This is the step number 5, step number 6. The sixth step is called as phagocytosis. Phagocytosis. Now, what does this mean? The word phagocytosis, it refers to a molecule which is recognizing and is also attaching. So, the first step is recognition and attachment. So, what is recognizing? Obviously, white blood cells. Recognizing what? The antigens, and attaching what? Again, the antigens. So basically, what I mean here is this step refers to a term where the neutrophils or the polymorphs, they recognize and attach. They recognize and attach the foreign antigens. Recognize and attach. Recognize what? They recognize what? They recognize self versus non-self. Obviously, what to attach? Recognize non-self because this is foreign. Okay? And don't attach the self. Recognize self and non-self and attach them. And attach them to its surface. This whole recognition, it occurs by two types of receptors. One is scavenger receptors and one are the mannose receptors. One is scavenger and one is mannose. One is scavenger and one is mannose. Okay, scavenger receptors and the mannose receptors. अच्छा, होता क्या है देखो, the scavenger receptors and mannose receptors, they basically, especially the mannose receptors, they are the ones which look for the mannose molecule on bacterial cell wall. Now remember one thing, the receptors have mannose and bacterial cell wall also have mannose. So this mannose will adhere all those cell wall which has mannose. So mannose receptors will recognize what? Mannose. Mannose is on what? Mannose on? Yes, bacterial cell wall. Because bacterial cell wall also have mannose molecules. Okay. Scavenger receptors, they recognize what? The antigen, especially the oxidized LTL. They recognize what is called as oxidized LTL. Just leave that right for now. Just remember, two of the receptors are very important here. One is a scavenger and one is a mannose receptors. Okay. Let's move to next step. Till now, what has happened? Till now, margination, rolling, adhesion, diapedesis, chemotaxis, and now what are we reading? We're reading phagocytosis. In this step, what is first step? Recognition and adhesion. Let's now understand. Suppose you want to eat a samosa. Samosa देखा है? Samosa. ऐसा samosa. है ना? What do you want with this? You want a क्या है ये? चटनी. हाँ जी, चटनी. तो you will dip this chutney on the samosa, lip smacking samosa. कितने लोगों को भूख लग गई होगी, कुछ खाने को मिलेगा. Now you're dipping this samosa on chutney. Why? Because you want to increase the taste, you want to make it more tasty. Similarly, our next step we are going to read, the next step we are going to read is called as opsonization. Opsonization मतलब coating of the antigen with a chutney, मतलब the opsonins. So refers to this step refers to coating of an antigen to increase the efficiency of phagocytosis. Coating of an antigen to increase efficiency of phagocytosis. This whole thing is mediated by opsonins or opsonizers. Opsonins and opsonizers. What are the examples of such opsonin and opsonizers? The examples are complement C, 3B, C, 4B, C, 5B. C matlab complement. What is C here? C is complement. Okay. Next one is C reactive protein. Okay. Here the C is, here the C, this one में यहाँ पर C is actually the capsular polysaccharide of the pneumococcal antigen, वो है the CRP. I'll talk about this separately also. Just first write the names. So first one, second one, third one is called as fibrinogen, and the fourth is called as FC receptor of immunoglobulin G. FC receptor of IgG molecule. Okay, FC receptor of IgG molecules. This is the last one. Okay, FC receptor of IgG molecule. So all those four molecules act as a chutney. And what does chutney do? Chutney will increase the taste. Chutney will increase the taste of the antigen to the polymorph or neutrophil. So how does it happen? Let's see the mechanism. Dekho. Let's see an example of the last one, this one. Let's say, suppose there is a antigen here, as okay, and to the antigen, the IgG molecule binds. To the antigen, the IgG molecule binds. Okay? Achha. Because of which what happens? Because of which what happens? The IgG has two parts. It has a FAB and a FC part, and this is a polymorph. ये polymorph है. Polymorph have the FC receptor of IgG. Polymorph have the FC receptor of IgG. So this IgG molecule, okay, it will go and attach to this polymorph here. Okay, it will go and attach to the polymorph here. Polymorph, the polymorph, it can destroy the antigen easily. Why? Because now the antigen is very close to the polymorph. It is something like you dip the samosa in a chutney and you want to put this close to your mouth because it's very tasty now. Similarly, this movement, you see this WBC moving, antigen moving close to the mouth, it is called as opsonization. It's called opsonization. Okay. This movement is called as opsonization. The entire antigen moving very close to the polymorph is being called as opsonization. Okay, opsonization. Okay. The next step, C, is called as engulfment. Engulfment. Achha, what happens here is the polymorph, it makes a pit like this, as it makes a pit in which the opsonized antigen moves inside. The opsonized antigen, it moves inside the pit like this. The opsonized antigen, it moves inside the pit. The moment it moves inside the pit, this antigen, it comes inside the vacuole, and the vacuole is called as a phagosome. The vacuole is called as a phagosome. Okay? It is called as phagosome. So phagosome has what? It has the opsonized antigen or any antigen inside it. It's called as phagosome. Okay? Achha. Now, if I ask you, or if someone asks you, batao, is the opsonization step essential? Is it must? So I'll ask you, is chutney must for eating a samosa? Won't you eat a samosa without a chutney? Yes, you can. But what is the advantage of putting a samosa chutney? It increases the taste. That means the opsonization is not essential. It will just increase the efficiency of phagocytosis. Clear? It is called as engulfment. This next step is called as engulfment.